So, good morning. I hexed myself yesterday when I was hoping not to be here today. And unfortunately, we had 4 more Albany County residents pass away last night. Our condolences and love go out to all the family members. They're all men, 2 in their 50s, 1 in his 60s, and 1 in his 70s. And one of the ones in their 50s that had no underlying health issues. Again, my condolences and prayers to the family that are going through this difficult time, especially with Christmas just around the corner tomorrow. So, into the 200 people now that we have lost in this county to COVID-19. It's a hard enough time in the world that we're in. It's even harder when you lose somebody either to COVID or to any other disease out there. So again, take a moment, and hopefully everyone takes a moment to send a prayer and condolences to these families. So as of today, we have 9,955 cases of COVID-19 in Albany County to date. Today, we have an increase of 269 positive cases since yesterday, the highest we've ever been. Yesterday, we saw an increase of 218, and the day before that was 226. I believe 228 was the highest we've ever been, so 269, it was looking like we were going to get well over 300 today. There are currently 3,302 people under mandatory quarantine, highest number we've had there too. Again, all records I'm not proud of that we're at. Just to look at some of the things, since November 24th, we had 101 positive cases. December 24th, we have 287, if you think of it that way. We had 148 people pass away before November 24th, and since then, in the last 30 days, we've had 52 people pass away to COVID-19. The numbers are very alarming and very high. For a variety of different reasons, some that we can predict, some that we can't, and some we'll never know why it's spreading like it is. But it's here, it's hitting us worse than it did in the beginning, and our numbers are going to continue to grow, unfortunately, with people traveling and people having gatherings tomorrow for Christmas or today, or out shopping and not doing the right thing, or wearing your mask or staying 6 feet apart. It's going to have an adverse effect on us. I just actually had a meeting with Phil Calderon, the airport CEO, was down in my office this morning with his counsel, and we were talking about that, and they were recommending no traveling, stay out of the airports for this reason here. And again, when you hear the CEO of an airport saying that, that's not what you're supposed to say. Come, fly, and mind you, they've gotten some national awards for being the cleanest airport in the nation and other things, but still, you need to stay home to do the right thing. So, of the new positive cases, 38 have close contact to positive cases, 7 are healthcare workers, 224 don't have a clear source of infection at this time. Over the last 5 days, we had been an average of 219 new positive cases each day. Yesterday, it was 200.8. As of today, 33,460 people have now completed quarantine. Of those, 8,525 were positive for the virus and have recovered, and that's an increase of 237 recoveries since yesterday. There are 14 new hospitalizations overnight. There are now 106 people currently hospitalized from the virus. Yesterday, we had 110, and the day before that, we had 107. Which was our peak then. We want to see continue downward trend with people staying in the hospital, but unfortunately, Dr. Venditti and Dr. McKenna and Dr. Whalen could talk about this more. We're seeing a huge increase, and it's just not about having hospitalization beds, as I've said yesterday. It's having the staff, because now you're seeing like domino effect where workers are going out and taking people around them to close that bubble in, and they don't have the staff for the beds. So that's something we have to continue. Unfortunately, there's still 22 patients currently in the ICU. Yesterday, it was 23. We continue to monitor all the hospitalization bed space. Yesterday it stayed at 25%. Today it's at 25%. But one of the things that have changed since yesterday, the ICU beds were at 24%. Now they're at 22%. So overnight they dropped 2%. So we'll continue to monitor that. And at the beginning of this month, they were at 46%. So you see in the last 30 days of the direction we continue to go in. I know the vaccine's here. And I want people to be happy with this holiday season and just appreciate what you have, right? But I'm not trying to scare you, but you really have to look at this vaccine's going to take time to get out. And, even the people that got the first round of the shots, it's going to be 3 weeks before they get the second shot. So it's going to take time for it to happen. Bear with us. We have to get it out, and it's going to take months. So please know that certain people may not get their first shots in May or June, or even later than that. So continue to wear your mask, cough into your arm, clean your hands, stay 6 feet apart, and we will get through this. And to the people again who are doing the right thing, thank you, thank you, thank you, thank you. To everyone trying to do their best, thank you. I know, again, the world's changed in the last 9 months, almost 10 months on us now, and it's going to be this way for a while. It's going to be this way for a while, but we can get through it, and we can get through it working together. So please, just a couple quick notes. Our first round of vaccine shots yesterday to the staff members. Now that the residents were done, so some of our staff were nice enough to let us take pictures of them getting it. I wish more would have gotten the vaccine, but we have to educate, talk to them, and get them to believe in this and get people behind it. And like I said, Monday was the first shot for our residents, and yesterday was the first shot for the workers. So again, thank you to everyone that's making it possible at our Shaker Place nursing home. So again, thank you to everyone out there. Please continue to be smart. Please continue to do the right thing. Again, we'll get through it if everyone's working together and doing the right stuff. Is it possible that you could get tested too soon after the original infection? It was a question that one of the reporters had for Dr. Whalen, so we put a slide together. Dr. Whalen, put the answer out there, but we thought we'd put up a slide and let people know the infection and how it works. The infection rate, and you could also get infected sooner after you get tested. So that's the other thing we want to continue to remind people. Just because you got tested, it's a snapshot in that time. Doesn't mean you didn't get it afterwards. It means you could have had it and it just came out a couple days later. And other than that, it's hard to explain why some people tested negative. I know somebody got 3 negative tests and then they got a positive. I don't know. Can't explain it, but I can just say it's just the way it's been working out. So please be patient and do the right thing. So Dr. Whalen.
I hope everyone is able to enjoy Christmas with their immediate family in their homes. We were here at Thanksgiving talking about the possibility of a surge upon a surge, and we're there. We are seeing the exponential rise in cases that we were afraid of on Thanksgiving. And it seems now that every day that we're here, we're talking about a new number of cases that's higher than anything we've previously seen before. Those of you that are celebrating Christmas, many of you have already made your plans. But there may be some of you that are sitting at home that are saying, perhaps you've been invited to something tonight that's outside of your home or tomorrow, and you're wondering, is this something that I should do? And for those of you that are listening and are considering, I would urge you to stay home. Stay home to protect yourself. Stay home to protect your family. Stay home to protect the community. Every single one of us has individual responsibility. And what we're seeing is a great deal of spread. And it's affecting many sectors of Albany County life. And we know that coronavirus is not through with us. And we know that there is concern about possible ability of coronavirus to spread more quickly than before. And that was a question that I know I was asked on the last press conference, are we aware of that variant in the United States that has been discussed in the United Kingdom? And I believe Wadsworth is looking at doing genetic sequencing, and at this point, I don't believe it's been identified within the United States. But as we know, it doesn't take long for these things to spread when travel has not been completely halted. So, we urge people to avoid traveling, particularly via air, if it's possible. We urge people to just celebrate the holidays with your immediate family. It is good news that the vaccine is available, that it's starting to trickle out, and we are following closely the suggestions on the tiered approach for our highest risk individuals. We are working very closely with the hub at Albany Medical Center, having daily meetings to discuss the deployment of vaccine and the strategies that are being employed. And I'm happy to say that our regional hub is involving all of their 8 local health departments in the decision making and in the planning going forward. We have mobilized our Medical Reserve Corps to provide assistance with disseminating vaccination and look forward to playing a role in that process as the days and weeks unfold. But it will take time. It will take a long time before we can vaccinate the general public and before we get to vaccination rates where we are no longer concerned with the strategies that we have been discussing for the past 9 months. So people need to remain patient and they need to remain on guard. It is an easy virus to catch. It is a virus that can be very dangerous. As we have indicated, we do have people in the hospital in their 20s. We have people in the hospital of all ages. And with the unfortunate deaths that we've seen this week, we've seen, a fair amount of people in their 50s lost to this. And across the country, we've seen people of all ages. So I urge you to take this seriously. I urge you to be aware of the fact that your choices that you're making, you don't want them to backfire. You don't want your choices to backfire. Nobody wants to have the regret afterwards that had I made a different choice, things would have been different for my family. It's a difficult message to give on Christmas and during the holiday season, but it is a necessary message. Be thankful for who you have, honor who you have, and do the right thing. Thanks.
Protect the people you love by staying away. Again, please just stay 6 feet apart if you have to see somebody, and do the right thing. As Dr. Whalen said, it is Christmas tomorrow. It is Christmas Eve tonight. I know people want to get together. I know they want to enjoy the holiday season together and New Year's together and forget about 2020. Well, 2020 is not going to be done with us well into 2021, unfortunately. So please just do the right thing for everyone around you. As testing's going on at the Times Union Center today, we said the schedule is going to adjust a little bit. Please go to our app at albanycounty.com, or website, not app, and then look at the app to look at some of the testing facilities. Some are closed today and tomorrow for Christmas, and they'll be reopened up on Saturday. So if you're looking to get a rapid test at some of the places, there's a few of them, the hours are different. Please take the time to look at that before you just show up in person, because I don't want you wasting your time. So please go there. If you need an appointment for our Whitney Young, as always, 518-465-4771. We cover the insurance as always. And the University at Albany, 188-364-3065. And again, go to albanycounty.com to look at the sites, because, again, it's going to be a little bit different. We can turn things around because we've done it before, right? And we did it when we got hit with the first wave, and we hit that curve and we went down. And this too shall start, hopefully we hit our peak, and when we get to the top of the apex, we start going the other way. But it's up to you. it's up to everyone who's watching this or listening to it through these holiday times to stay away, or we're going to continue to have this for a long time. And unfortunately, people are going to pass away or go to the hospital or go to the ICU. And yes, thank goodness more people do recover from this. So we're not, we put both numbers out, Dr. Whalen and I. And I don't want anyone going to the hospital at all. And I said it yesterday, the alarming fact that we're seeing more people under 25 is getting to be alarming. And the effect this is having on 50-year-olds is getting alarming. And the effect that it's having on the Asian community is alarming this month of December for some reason. So these are things we continue to look at. These are statistics we got to look at. And why is it affecting certain populations differently? So please, we want you to celebrate Christmas and Kwanzaa over the next few days. Be safe, be healthy, be smart, do the right thing, and don't be ashamed to call the mental health hotline. I've known, I talked to a lot of people. Dr. Whalen's the doctor. I'm just here. And, don't be shameful. People deal with things differently. They deal with death differently. They deal with life in general differently. People don't like going to see relatives in the hospital because they just can't handle it. You know what? The world's different. Things are different around us. Please reach out. No one's going to come arrest you. No one's going to come lock you up. They're there just to talk to you and hear you and talk you through it. Talk to the experts, And I know some people are afraid to talk to your friends or your loved ones or your husbands or spouses. You're afraid to say something. Your boyfriend, you're afraid to say something because you're afraid they're going to look at you differently. Call the number. Call the number, and especially, again, parents with children. I know this is a difficult time. I see the struggles my kids are going through. I know Dr. Whalen could say the same thing. It's tough. It's a new world for them. But these kids are resilient. They'll snap through it, but it is changing them psychologically. So please take the time, parents, guardians, loved ones, take the time to talk to somebody you haven't talked to. And if you're fighting with somebody, who cares? Forget about it. Just call them up and just, say, hey, look, don't know why we're fighting, but let's get through this together. Again, that number is available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. Our 24-hour sexual assault hotline, as always, 518-447-7716. The 201 in the New York State hotline. Please, people, continue to, yes, I know someone was having fun with me on a certain station. Please, I do sound like a broken record. Wear your mask, cough into your arm, clean your hands, stay 6 feet apart. We'll get through it. Thank you, everyone. Stay safe.